Welcome to the Dr. Paul Show. I want to talk about psychosomatic. What does that mean? So this is a term that goes deep to the heart of my practice. When I started practice in the early 90s, I started understanding early on that there was this connection between the mind and body. This started with when the medication Effexor came out. You might, if you watch my show, you're going to hear that Effexor or Pristiq or Cymbalta. These are medications that I discovered early on that were really helping people's emotions as well as their physical symptoms. So I started to see, which was different than the SSRIs like Zoloft and Lexapro and Prozac. I didn't see that. But when I was seeing these medications that balance norepinephrine, I started seeing these amazing things happening. People with conditions, and when I started seeing this, I was a family doctor at the time, and I was really seeing like there's a lot of these mystery illnesses that we see, like irritable bowel syndrome, fibromyalgia. People, I mean, the most common symptom that people get with stress, and everyone's going to relate to that, is these muscles: neck, shoulder, upper back. This is where most massage therapists spend their time, is these areas. And that's where they can tell like the person's under stress, when they have to spend so much time like working out all the knots in the muscles, and headaches, like I said, stomach issues, acid reflux, irritable bowel, cramping, bloating, diarrhea, constipation, chest pain, tightness, sweating. So there's a lot of like physical symptoms related to stress. A problem with breathing, shortness of breath, and then people get panicked. I think I'm having a heart attack, and they're because I have chest pain, and I think I have some tingling, and I think, isn't that what a heart does? And so they go to the emergency room. A lot of people with psychosomatic illnesses end up in the ER. They're thinking they're having a heart attack, or they have a headache, and they think they have brain cancer. Then they get reassured, you're fine, go home, go see your doctor. But the thing is, oftentimes they get brushed off, and it's like, well, we checked your heart is fine, and everything is fine, you're healthy, we checked your blood tests. And then the person leaves saying, well, what's wrong then? I mean, so it's almost like the only thing that's real is what you can check with blood or a scan. No, that's not the way the nervous system works. So what I discovered is that these psychosomatic illnesses are due to imbalances within the nervous system itself. And what I've discovered is when you treat those imbalances, and when the medications like rebalance the chemicals in the right direction, not the wrong direction, that leads to the healing of the body and the mind. So what I really started seeing is when you resolve the anxiety properly with the proper medications, that you resolve all these somatic. So when we say psycho, mind, somatic, body, so psychosomatic means mind, body. Well, I call what I do mind-body medicine, and mind-body medicine meaning I don't only focus on the mood, but also the physical symptoms, and that comes from my family practice days. So I'm still a family doctor, but my practice is different now. But psychosomatic really goes to the heart of my books. If you look at the title of my first 3 books, Healing the Mind and Body. Well, that mind-body connection is exactly what psychosomatic means, and that's what really drove everything in my practice from the beginning, and it's still to this day. People having like even rheumatoid arthritis, or people who have conditions people say, well, you don't get it. I have real problems. I have a slip disc. I have all these things, and then how can my slip disc, the pain that goes up, my sciatic nerve pain that I thought would never get better, how come that's getting better? What's this doing? I go, well, it's not. What it's doing is it's going inside the nerve and balancing it. So it's working around the kink. So if you have a blockage in your back, it kind of works around it. You get the flow of the chemicals better, then all of a sudden the symptom can go away. So I've seen sciatic nerve pain, rheumatoid arthritis, these conditions that people would think that they're on pain medication. They would think there's no solution. And then all of a sudden I treat it, and their pain medications go away, or they go way down, or they're not taking so many of them. And it can make a huge difference when you get to the core of the problem and treat it, and not just surface treat. I call the Band-Aid approach to medicine. The Band-Aiding meaning giving a symptom, getting something for a symptom, an anti-inflammatory, a pain pill, an anti-anxiety pill, a sleeping pill, and not trying to step back and saying, well, what's causing the pain? What's causing the anxiety? What's causing the insomnia? So I try to look deeper, get to the core of the problem, and try to fix it right there. And so that's the true meaning of psychosomatic. So if you're interested in the subject, like I said, my first 3 books talk a lot about this, including with my new book, The Corona Protocol. If you want to delve deeper into the subject, you can do so. If you want, like I said, if you find this interesting, if you want to share, please like and subscribe and share this with your friends, because this is so common. If you ask people, a lot of people will tell you that they have these kind of conditions, and a lot of people don't think there's treatment for it, and they have no hope. So if you tell them that, to watch this video, check out my practice, give us a call, check out my website, and we can definitely help. So as I said, if you can please like and subscribe and share this with your friends, and anyone interested in seeing me in my office or seeing me virtually, give us a call.